Good morning, good morning, good morning, and welcome to the Great Lakes Health Radio program with your host, Francesca Messiah from Kaleida Health. You might wonder, and I know I say this all the time, but I still get the question in the community, who is Kaleida Health? Well, we are hospitals and we're clinics. We're Buffalo General Medical Center, we're Oshai Children's Hospital, we're Gates Vascular Institute, Millard Fillmore Suburban, Visiting Nursing Association, VNA, DeGraff Medical Park, and we have clinics for adults on Hurdle Elmwood, and we have two clinics for children, one Niagara Peds on Niagara Street, and the other one is a Children's Pediatric Center on Broadway Avenue across the street from the Broadway Market. We have two women's health centers, one on Kensington Avenue, located on the property of ECMC, and there's a bus stop right in front of it. And also on Niagara Street, a bus stop right in front of that, about a block from the Tops Market. We have two long-term facilities, one in Buffalo, that's High Point at the corner of High and Michigan Avenue. And we also have a long-term facility in North Tonawanda on the same location as DeGraff Medical Park. And also, if you are interested in hearing any of our past broadcasts, please visit www.kaleidahealth.org/video. Again, that's www.kaleidahealth.org/videos. And feel free to share these, use the videos, review the videos, share them with your youth group, your church organization, your PTA, your PTO for your personal use. All of our videos, you'll see the titles, you'll hear the titles, and all of the information is factual on the videos. And I'm just really moving one more thing before we begin our program. I want to mention that we are having a very large job fair, that's Kaleida Health, on October 4th from noon until 4 p.m. at the Highmark Stadium. So it's October 4th, noon to 4 p.m. at Highmark Stadium. Free bus transportation, NFTA. If you get the pass, we'll take you there for free. For more information and how to get that pass, please send me an email at fmessiah, MESIAH, at Kaleida Health, KALEIDAHEALTH.org, and put in the subject line job fair. So it's a job fair at Highmark Stadium, that's Buffalo Bills Stadium, on October 4th from noon until 7 p.m. There'll be raffle for Buffalo Bills tickets. And if you need information on the transportation or any questions, please send me an email at fmessiah, MESIAH, at kaleidahealth.org. I just had to mention that. Well, on with our show. We've had several shows recently talking about UB Medical School. UB Medical School, if you didn't know, has relocated a couple of years ago from the UB campus on Main Street to downtown Buffalo, the corner of Main and High Street. And today we're going to be talking about interprofessional education. What we're talking about are when the students graduate from medical school, making them comfortable, not only making them comfortable about working with the community, working with patients, also interacting and making so that the patients, the community, are comfortable interacting with physicians. And today on our program, we have we have two physicians, and we also have Dr. Kelly Ramos, who is a doctor of nursing education curriculum. First, I'm going to introduce this because I started out with Dr. Ramos. Dr. Kelly Foltz Ramos, could you please introduce yourself and your title?
Sure. Yes, this is Kelly Foltz Ramos. I'm a member of the leadership team for interprofessional education at the University of Buffalo, and I am the director of simulation and an assistant professor at the University of Buffalo School of Nursing.
Thank you. And Dr. Snyder, Dr. Kenneth Snyder, he doesn't really need an introduction because he's been a guest on so many programs, a true friend of the community. Dr. Snyder, could you please introduce yourself?
Sure, Fran, thanks for having me on again. Honored to participate. Dr. Snyder, a vascular neurosurgeon, Vice President of Physician Quality for Kaleida Health and Director of Health System Science for the medical school, and honored to participate and learn from our colleagues in interprofessional education, again, that focus on all of the health science teams and us all learning together as the focus. It's a true paradigm shift, and this group that's with us today and Dr. Patricia Otaki, who's helped lead it, have really led national excellence in this field. So excited to have a conversation about it today.
Thank you. And finally, last but not least, is Dr. Joseph Gammacorda. Dr. Gammacorda, could you please introduce yourself?
Certainly. Good morning, everyone, and thanks for joining the call today. We appreciate it. My name is Joseph Gambacorda. I'm a faculty member at the UB School of Dental Medicine, and I am the interim assistant vice president for interprofessional education at the University of Buffalo. And as Dr. Snyder mentioned, this really is a paradigm shift in looking at how healthcare is delivered and how students that are part of an academic health center at a university are taught. With this, what we're hoping on is for better health outcomes for those in the community of who we treat. Pleasure to join you this morning. I appreciate the opportunity.
Thank you. And before I start with the first question, I just want to say not only initially this conversation, I want to say, began a good 4 or 5 years ago. I know it was before COVID. And I just want the listeners to know community was part of the conversation, looking at the medical school. How could the medical school and community begin to interact? Because they're right there at the corner of Main and High. For those of you who remember, that really like across the street from where Gleason's used to be. And this conversation began in that first room in the medical school when you walk in the building. And there were many members of the community, all professions. Like I said, I know I was one of the members. And it's just really exciting now doing this interview. But let me stop talking. And I'm going to ask the first question. What is IPE, and did IPE begin in Buffalo?
I could take that. Interprofessional education really takes place when two or more professions learn with and about and from each other to enable effective collaboration and improve healthcare outcomes. So when you're looking at two or more professions, so you're going to take students, residents, and healthcare workers from, say, nursing and medicine, or nursing, dentistry, pharmacy, and dentistry. And you're really looking to bring these individual groups together to work as a team to provide care to the patients. And the whole idea behind this is to really transform how healthcare is delivered, putting the patient first and really trying to enhance the healthcare outcomes the patients experience by having multiple providers talking about an individual case and working as a team to provide care to that patient, because every discipline brings something to the table. And several patients that we treat have other needs that will say, for example, I'm a dentist. So I cannot deliver care and address all the needs of a particular patient that I treat. And so now, as I work as part of a collaborative team, I can bring individuals in from, say, social work, pharmacy, medicine, nursing, physical therapy, occupational therapy, bring all these, discipline-specific individuals into a group to really manage a patient's care plan. And this really helps enhance healthcare outcomes and provides a much better care to the patient. As far as did IPE begin in Buffalo, I did do a little research to try and figure out exactly where IPE began, and I couldn't find it. Maybe Dr. Steiter or Dr. Foltz-Ramos has an idea of where it initiated. Some of the research I was able to find, it did begin somewhere in the 1960s at different pinpoints and different levels. But IPE now, because of the engagement of the World Health Organization and accrediting bodies of schools within academic health centers, have now put in guidelines that students involved in these curricular programs need to have experiences working with other disciplines and other practitioners to treat patients. So the accrediting bodies that work within higher education have realized the importance of collaborative practice and engaging other disciplines in the care of patients. And now this is being brought to the forefront of curricular change and how models are developed to bring disciplines together to treat patients.
Yeah, no, that's great. Because we can't look at anything in a bubble. Nothing,
Correct.
no problem. No part of society. How does it benefit the community and the students? So are the students working with the community? Does the community come into the medical school?
Francesca, I was hoping to build off of what Dr. Gambacorta said and set up some conversation for Dr. Kelly Ramos, whose expertise is exceptional, and also answer that question. Think of all of the different 5 health science schools: the School of Medicine, the School of Nursing, the School of Dental Medicine, the School of Public Health, and School of Pharmacy, all combining on specific curriculum. And it's one thing to think about how beneficial it would be potentially to just be talking to one another in the classroom together. But what Dr. Otake, Dr. Gambacorta, Dr. Kelly Ramos have done, I think, is transform a few things. Imagine multiple disciplines all out in someone's home, listening to someone talk about their chronic illness, and the therapy teams, the other teams, and others all listening and understanding and thinking about how they might all be able to collaborate and fit in and better serve that patient in their community and what their need is. And not having a single specialty alone sit and listen to the patient. And what happens is you end up building an unbelievable mutual respect and understanding of the importance of every element of the team and how we can support each other to support the patient. And so there's community engagement in how we're going out and learning and listening to people that are experiencing the health system collectively so that we can bring that back both to our curriculum and our practice change. Dr. Ramos's expertise, amongst many things in her doctorate in education and other, is also in simulation. And when you talk about what might be unique to Buffalo, I think what Dr. Ramos brings is, I don't want to just teach in the classroom. Let's set up hypothetical scenarios and watch our students interact with patients in a simulation to develop the skills and learn together to then put it into practice. As Dr. Gambacorta, Dr. Otake, and Dr. Kelly Foltz Ramos put together a program called Team Steps, which is done nationally. The twist in what's been done differently is that they do these simulation experiences to further ingrain the tactic. And what I love about the UB program is they reached across the street to the hospital system to say, we need you engaged in learning with us, because if the students don't see it in practice, it won't stick. And so it's one of the first major programs that health professionals are coming in and learning with and from the educators to help educate our students. And that's what's so exciting to me about the Buffalo view and the Buffalo program.
Thank you. And Dr. Ramos, would you like to add to that?
Sure. First of all, I'd like to thank Dr. Snyder, because without him, I don't know if it would be as easy getting all the participation. He was definitely a big part of getting the practice partners together with the academic setting. But a big part of simulation is the debriefing that comes after simulation. So we have a conversation about what went on during the scenario. And our partners from Kaleida help to facilitate those simulation for our learners, and the ability for them to show the value that Team Steps has and working together as a team and communicating to our students really is invaluable. It really shows them that how to work when they finish their program. So learning how to work together right from the beginning of their education. So they're not afraid to talk to each other. They understand each other's roles and responsibilities. They have mutual respect for each other. And we also teach them some conflict resolution skills that aren't necessarily easy for everyone to do, but it's great to prepare them ahead of time.
Okay, now that really conflict resolution, what do you mean by that? And it's just so, fascinating. What do you mean by conflict resolution? You mean within the students, within the disciplines, there might be conflict resolution? Because I've never heard of that.
Yes, definitely. So, a couple of the tools for team steps that involve conflict resolution are one is called CUS, C-U-S. So it's I'm concerned, this is unsafe, stop the line. It gives the student a script, or the future provider a script to follow when they see something that maybe doesn't look right, doesn't look safe. It gives them a way to communicate that information respectfully. And if we all know team steps and we all understand the language, as soon as you hear, I'm concerned, you know immediately that there's a safety issue and you have to stop and think about what you're doing.
I can see a second show. So I'm going to keep moving because all these questions are coming. So then the principles, the ultimate goal, is this the students' freshman year that they go through this? And that's a lot of departments, because you said it's medicine, it's public health, it's dental, it's nursing, pharmacy, physical therapy. Is this just like a one class, or is this throughout their 4 years in medical school? Is this residency? Like that's a lot to fit in. So if someone could answer one or all the questions.
Yeah. So really what we're trying to do in our program is develop touch points for every year a student's involved in the curriculum to have some type of information and coursework dedicated to interprofessional education and collaborative practice. As Dr. Snyder mentioned, trying to train individual students to go out there and work in the community as part of a team is exceptionally important. So we have certain events. So say for the first year students in various disciplines, we have a part of our curriculum called Friday Night at the ER. And that's where we get about 100, little more than 100 students from multiple disciplines. And we set these students up in groups of 4, and they play a board game that's really about managing a hospital situation. And throughout the game, there's decisions that these individuals have to make because they're managing a different aspect of the hospital, right? Whether it's the operating room, the emergency department, or say a regular floor, right? And so through that collaboration, they learn to work together to manage the patient's needs, the hospital system needs, the staffing needs. So there's a lot of things, and that's a more of an introductory experience. And then as you go on, as was mentioned, we have our Team Steps program, and we have different groups that participate in different years for that. And in a lot of cases, it's second year students. In some cases, it's third year students in different programs. And not all programs are participating in every one of our programs. That's one of our goals, is to get all of the units within the Academic Health Center at UB. And we also work with Canisius College Physician Assistant Program as well, under the direction of Dr. Amy Larson. And so bringing all these groups together at different touch points, and during the third year, what we have is our IP forum, where we bring a bunch of individuals together. We present a clinical case, and we talk about certain aspects. So for example, our fall case is revolving around the social determinants of health, and how are we managing a specific patient's case with multiple disciplines, understanding how this individual and this individual's family is being impacted by the social determinants. So our goal is different touch points And as was mentioned, kind of bringing this to the forefront and trying to educate not only the students really, but what we're looking to do is bring in other faculty members to act as facilitators, to act as trainers. And I've learned a ton as an let's say a older faculty member, shall we say, where this wasn't taught when I was in school. So I've learned a lot now about how can I collaborate better with the patients I'm working on at school, and how can they be trained. So it works is we're training the new generation of practitioners, but we're also putting these ideas of collaboration into the practitioners who maybe have been working in somewhat of a siloed office setting or hospital setting, or fairly qualified health center, whatever the setting may be. A lot of care has been siloed. Now the goal is to expand that silo, bring other groups together to better treat the patients.
Is there any type of a card that the patient is given so they know what, because this is amazing. This is amazing. So as this process is being rolled out, as IPE is being rolled out, on the side for the patient, is there a card for the patient to make sure that they're asking their primary care, they're asking their dentist, they're asking the pharmacy? Because a lot of times I notice that, let's say you go to the drugstore and it says, ask the pharmacist, but people don't know what question to ask. It's not that, is that, yeah, sorry, go ahead.
Fran, I'll take that only because I've had the context with you of one of the main themes that I love that you bring forward on all of your shows is empowering the community and empowering the patient. And I think we've brought this up a few ways. One of them is we work for them, right? They're paying us for a service. You need to be comfortable asking us questions, whether it's inpatient or outpatient. But I think the main point you're getting to, and it's part of the main flaw we have in the systems of care we provide right now, is the person asking the question, are you all talking to one another? Do you even know what the doc that was just in the room or the nurse was in the room said to me, so that we're all in sync? Are you all in sync on my care plan? That's the question. That's what we're trying to achieve, is ensuring that we're not working in silos, living in silos, documenting in silos, and caring for that patient in silos. And so the foundation that's being built in interprofessional education, you can't start too early the themes on teaching communication and conflict resolution. And so this is the foundation where we're leading, I think nationally leading, and have nationally been recognized. People on this call today are nationally recognized for the work that they're doing in this. And the beauty of what they've done in reaching out, and Dr. Gambacord has just nailed it, we've got to bring the practitioners in so that it ingrains into their workflow as well for those that haven't undergone this curriculum change. And again, it's very exciting, and our community should be very excited about it. The question they should ask is, are you all talking to one another? Are you all in sync?
Yeah, and I don't know if you know Dr. Sperry. Dr. Sperry has always brought different professions into to talk to the patient, and now it's making sense. Now it's, thank you for making why this is like it's making sense. I hate to say we only have 5 minutes left. That's why I said we're going to do a part 2. Any barriers to this IPE?
I can talk about a barrier. We've been talking about all of the different the programs involved, and we actually have 15 programs across 9 schools within the University of Buffalo. The logistics for interprofessional education are really difficult. So getting the same level of learners together, the same date, same time, same location is really difficult, but having support from administration, really, we do research with every program so that we can show the benefit, and then we publish manuscripts, we present locally, nationally, internationally to support other schools so they have the evidence that they need to start their own programs.
This is a fascinating topic, and like I said, I know I'll do part 2. Any closing remarks?
I would like to just add, for the patients that are listening and members of the community, please talk to your healthcare provider. Please ask questions. Please introduce and say, how can you help me with these particular problems that I may be having? In what we're trying to do is educate students on providing total patient-centered care. And please, as patients who access healthcare, members of the community, we want to help you, right? As Dr. Snyder mentioned, our goal is to help people and to train and get better healthcare outcomes for you. And I really stress, if you're having an issue, even though it may not be related to what you sought care for, please bring it up to your provider, because there are methodologies in place where that provider can help you and link you to services to address some of your other needs. So just because you may be going to a physician or a dentist and you're having some other issue, talk it over with your healthcare provider. They may be able to provide you access to helping you in relieving some of those issues that you're having.
Thank you. Dr. Snyder, any last sentence?
I love that Dr. Kelly Foltz-Ramos brought up safety and the culture of safety. Mm-hmm. I think that for us to best serve you all in our community, we need to be helping look over each other's backs to keep each other as safe as possible. We're human, and even in this profession where we expect excellence and expect perfection every day, that will only occur with the nurses helping look out for the doctors look out for the nurses, the dentists helping as well, the public health people involved, the pharmacists. It takes all disciplines working together to help each other to deliver excellence in care. And I think part of our issues in outcomes, in patient experience, in costs of care, and in burnout of our healthcare teams is that we're not great at this. By curriculum and changing it and ingraining it early, and as Dr. Gambacorda and Dr. Kelly Foltz-Ramos brought up, by bringing our professionals in to remember and continuously learn both from the students and from each other, I am so excited to be part of the Care in Buffalo, because we're not giving up. We're realizing this form of education is what's going to make the system better and make us better as providers.
Yeah, well said, Ken. Thank you. Great.
On that note, I want to thank Dr. Kenneth Snyder, Dr. Joseph Gambacorda, and Dr. Kelly Foltz-Ramos. I want to thank you all for taking time this morning to talk about interprofessional education, the impact of change on the UB Medical School curriculum, part 1, because I do have a title for part 2. I'm thinking around December or so we will have a part 2. So I want to thank you, each of you, for being our guests this morning on the Great Lakes Health Radio program. We're going to focus on a large job fair coming up at the Bill Stadium on October 4th. So if you're wondering, today's topic is a job fair sponsored by Kaleida Health on October 4th. Again, Kaleida is hiring all positions 18 years old, 18 years of age and up, with at least a high school or a GED degree. Our careers begin, and that is KaleidaHealth.org/careers. Come grow with us. Well, I was rushing a little through that because our program today is so important, because we're talking about jobs. And our guest for today is Julie McNeil. Good morning, Julie. How are you?
Good morning. I'm good. Thank you for having me.
Oh, you're welcome. And Julie is a manager of talent acquisitions. Now, let her explain what that means in the world of the jobs. So, Julie, today's topic, as I said, we're talking about the Kaleida Health Job Fair at Highmark Stadium, and that's taking place in October 4th. And Julie, so my first question is, if you could explain what is talent acquisition, and let's just jump right into the job fair. What types of jobs and careers does Kaleida Health offer?
Sure. My talent acquisition team handles all of the hiring across Kaleida facilities for any position that we have. So we have tons of different positions. We're hiring for all shifts, all departments, in all roles. Some of our key positions that we're looking for, of course, are nursing across the whole organization. We also are looking for environmental service workers, clinical lab scientists, and med techs. Are two positions that are we're searching for currently. Of course, certified medical assistants, respiratory therapists, IT professionals. In our long-term care realm, we have nursing, nurse managers, CNAs. We also have that CNA.
We can't use jargons on this program. What's a
Oh,
CNA?
I'm sorry, certified nursing assistants. Sorry about that. And we do hold certified nursing assistant training also. In the home health world, we have office positions, we have nursing positions, we also have pharmacy positions. So, really, anything that you can think of, we are currently hiring for. And everybody will be at that job fair doing on site interviews.
Okay, Julie, everything you mentioned is basically has a degree or a certificate tied to it. Could you talk about if I'm straight out of high school, I'm interested in this job fair at Highmark Stadium on October 4th, and I'm straight out of high school. I have a really great I have a great high school diploma, or I've been out of high school a couple of years, and I just received my certificate, GED certificate. What are the kind of jobs that I would be, someone not I, but what kind of jobs would someone just coming out of high school, not nursing, what are their opportunities?
So we have environmental service workers, nutritional service workers, patient care associates. Again, the certified nursing associate program, you can get enrolled and become a certified nursing associate through us. We also have hospitality associates, unit secretaries. There are definitely tons of positions at the entry level.
Okay. Yeah. And that's why I wanted to make sure that our listeners know, because this is, for the most part, WFO, this station, we have three generations of listeners. We have the grandmother, the grandfather, we have the parent, and we have the child who could be 18 or 17 getting ready to come out of school. Okay. So what date is this and what time is the health fair?
Yep, the job fair is on October 4th.
Job fair,
It's from,
job fair.
that's all right. It's from 12 p.m. to 7 p.m. right at Highmark Stadium. You would enter through, and excuse me, park in lot 2 and enter through gate 2, but there will be signage out front. And there is also a bus stop that is not too far, and we will be having bus passes for that.
And I know we are working on a flyer, and I will share listeners. I will share the flyer with WFO, so they also have the information. But you talk about bus passes. Well, let's do the time, the date and the time again. The date of this is
October 4th.
And the time
from 12 to 7.
And parking is lot where?
Lot 2, and you'll see that right off of Abbott.
Right off of Abbott Road. And now let's talk about the bus pass. How's that going to work?
So there'll be a pre-registration QR code that'll be coming out very soon. You'll be able to scan and register to come into our job fair, and there'll also be some information on our flyers in regards to obtaining a NFTA all-day bus pass. You'll be able to log into their app and register with a specific code that will allow you that bus pass for the day to come out and see us.
If someone is having problems obtaining that, can they call you and get, or who would they call to?
They can definitely give me a call, and I can walk them through the process and get them set up with one.
And your number slowly, please.
Sure. It's 859-8561.
And one more time, please.
Sure, it's 716-859-8561.
You. And now, is there a cutoff age, meaning too young or too old to apply for jobs at Kaleida?
You would have to be 18 years old, but there's no cutoff on the age at the top.
What if someone is in a wheelchair or visually challenged or hearing challenged? Can they apply?
Yeah, we would work with our labor department to make sure they had any necessities that they may need for the position and make sure that we can accommodate that.
Mm-hmm. Now, why? I mean, Kaleida's been in Buffalo. Well, Kaleida hasn't been around, but the hospital sites have been around for over 150 years. So why this big job fair? Why now?
There's a need, and we love to have our community come and help and take care of our community itself. So there's definitely tons of positions open, and we're just trying to make sure we get our community involved in taking care of each other.
Thank you. And I've been on the planning committee for this, and there are some really unique raffles. Could you talk a little bit about for participants who attend the job fairs? Could you share with the information about the raffles and giveaways and things that will be there for coming?
Absolutely. We are going to be with pre-registration and registration at the door in case you weren't unable to register online. We will be putting you in a raffle for 2 sets of tickets to a Bills game. Also, the Bills have staffed us with 2 tour guides that will be giving tours from, I believe, 1:30 to 5 that day. And they'll be able to go on tours with the tour guides to see the locker rooms, to go down on the field and just really take a tour of the facility. So that's super exciting for even us.
And I have to admit, I believe it was last year I took one of the Bills tours, and I have to admit, I had to run into the field like they do in the opening. People were just looking at. I mean, I was like, dressed in regular clothing, but we had to run. I just couldn't walk onto the field. I had to.
Yeah, it's super exciting.
Yes. You know what, Julie? Okay, so I just want to go back to the bus again, because we've really been working closely with our partners in transportation. And so when someone goes online and they register, what will they, and they say they want to catch the bus, will they then receive a bus pass, or how does that work?
It's going to come through. So NFTA actually has an app for your phone. So they'll go through, they'll register, and it'll be right there on their phone. And again, it'll be a day pass that we provide for them to come out to the job fair. So it'll be right on their phone for them. And I'm sure if there was, maybe they don't have the app, it would go through email.
And I have to say that is unique, because I know that's something that, being part of the Buffalo community, we've talked about before, and I'm just so glad. So many things are possible. So I'm just really glad that with this job fair on October 4th from noon until 7 p.m., that for persons without transportation, or anything can happen to our transportation. We know that.
Right.
I'm just glad that there is another alternative to come and look for a job. Okay, so we're at the job fair. It is 2 p.m. in the afternoon. I'm at the door. I've registered. What should I bring? Besides a good personality, a good attitude, what else should I bring with me?
I recommend bringing your resume with you. That way the managers and our talent acquisition team has something to kind of refer to as they're interviewing with you.
And you say, will there be, okay, let's say I have my resume on my phone. Is there going to be access to a printer, or should I try and print it out before I arrive?
If possible, print it out. If not, we can definitely figure out how to get it printed and over to the manager.
So are you doing on-site interviews, and what areas are you doing on-site interviews?
We are doing on-site interviews. It'll be for all positions. We will have management staff there from every department to do those on-site interviews, and also, leaving there with a soft offer and following up with our talent acquisition team.
Okay, what's a soft offer?
Just because sometimes you might not have applied, so we're not going to be able to process you right there. So when you leave, you'll have what position you are going to be considered for, and then also the talent acquisition partner you're going to follow up with. And then the next day, we'll have you follow up with that talent acquisition partner, and they'll begin the process of getting you hired.
Okay, all right. So let's say, I'm 18 years old. My friend, I'm telling my friend about this show, about the job interview. And we're gonna come out. We're just coming straight from school, and we just wanna come in and apply for jobs. How about any tips for should my friend and I be concerned if we have our jeans all cut out and different things? I mean, is there a look, such a thing as coming dressed for an interview?
Yeah, absolutely. We're going to be interviewing right on site, so I would come dressed for an interview, business casual, or jeans with no holes, and just coming in looking presentable, all clean and ready to be interviewed by our managers.
Hmm. Yeah, so I just want you to know, students to know. I mean, you can come that day, but if you know ahead of time you're coming in, you don't have to be a student. You can be an adult in your 40s. But it is important. Dress is important, not just, you don't have to buy anything new, but if you can avoid the jeans with the holes, right? That would be something possible.
Yeah, yeah.
Yeah. If you can avoid, if not, everybody's welcome. And of course you can come as you are. What if someone is unable to participate, however, there's something that's come up, or or they're just unable to participate? What should they do?
They can always go to our website and apply online. Also, again, they can give me a call and say they have applied, or shoot us an email, and I can have one of the recruiters follow up.
And where would they call or go online?
Our website is kaleidahealth.org /careers, and all of our positions for the entire system are listed there. They can also reach out to me at 716-859-8561.
One more time, Julie.
Sure, 716-859-8561.
Something else that I want to touch on, a resume. If someone hasn't had one in a long time, or they've never had one, could you just walk us through the steps of what a resume? Does it have to be fancy? Does it have to be, prepared by a professional with all different types of fonts and things? What are the key ingredients of a resume?
Sure. I've been in recruiting for 18 years. Some of the things I look for is the first thing I'm looking for, obviously, is your work history. So nothing, it doesn't have to be completely detailed. You don't have to write me a book on your resume. Tell me where you've been, of how long you were there, a general overview of the position, because that's going to give me talking points while we're interviewing, and allow me to ask you questions about what you did in that position, what you liked about that position, and things like that. So nothing super fancy, but something, with your job history on it, with your contact information, so we can follow up with you after. All of those things are very important, but we don't need anything elaborate.
So you know what? I like what you just said. A resume provides talking points during the interview.
Yeah.
And that is key. That's very key. What else? There's something else that you mentioned about a resume and talking points. Should you include what else should it include? hobbies? What else besides your current position? What else should be should be considered for a resume?
Yeah, like you said, definitely your contact information. Make sure it's up to date. I will be honest, sometimes we'll get a resume that doesn't have an up to date phone number, and that makes it difficult to get a hold of you, or even an up to date or an email address that you do use a lot. I know a lot of people have a couple different emails, so we want to make sure the one that you utilize the most is the one that's on your resume. Also, different, like, there is usually sections to put hobbies, and a lot of times that'll point to fun things that you like to do, and we can see if that will also tie into any of the positions that we have. Your education is on there, that would be great. um, Really just the basics, so we can definitely chat through the interview process with you.
Mm-hmm. And also on a resume, you can include the church you go to. That's okay, or you
Yes.
know that. But hobbies, especially if they're hobbies that tie in to the position you're looking for. Because remember, on a resume, they're trying to see the job that you're applying for. Doesn't matter if it's a certified nursing assistant, if it's a licensed practical nurse, if it's environmental, if it's a painter, if it's they want to see are the things you're applying for. Do you have any experience? What is your experience, and how long have you had been this experience? Am I correct in saying that?
Yes, yes. You never know. You may not be working in the position you want. Like you mentioned, painter. You may not be working as a painter, but you may do that on the side. So it's something we can definitely
Right.
take a look at.
So every summer you paint 5 homes. That
Right.
goes to show you have some experience.
Yes, exactly.
Never take what you do lightly. And if you're a younger person, after school you take care of your siblings. Include that after school, responsible for looking after children, age whatever, providing guidance and direction, something like that. But
Yeah.
whatever you do, it has value. Email. I know we're running out of time. Email. How important is an email? Let's say an email that says baby at 6066 at gmail.com versus your name. I'll say Francesca Messiah, 1856 at. But how important is what you say in your, drop it like it's hot, 22 at AOL. So how important is the do you look at that, like what's the title in the email?
Absolutely. Absolutely. I mean, I know we all made our emails originally, probably when we were a lot younger and didn't think about it, but I would definitely consider making yourself just a professional email for any job applications that you do.
And that, and also with your ringtone, with your not ringtone, with your voicemail. If
Yeah.
you have a song, gotta love you more, something like that. Can you change that to just a plain, you have reached, the phone number, please leave a message? How important is, and some people have songs for that. How important is that?
Yeah, just to have, a professional voicemail that states who we're calling, like you said, the phone number, just so we know we're reaching the right person.
Yeah. Yeah. And you know what? We're almost out of time. What are some things you would like to add to this interview?
I just think everybody should come out and see us. Like I said, we're going to have all of our managers on site to interview for any position that we have open. Definitely take a peek at our website before you go, so you may know what you're coming to apply to. If not, that's fine. We're going to have people there directing you and chatting with you. My talent acquisition team's going to be there to chat about many positions. So definitely come out and see us. It's going to be a really fun event. And I mean, again, the plus is taking that tour and running out of that tunnel.
How about the date? If you could let us know the date and time
Sure.
again.
It's October 4th from 12 p.m. to 7 p.m. And again, right off Abbott, pulling into lot 2 and walking into gate 2.
What if someone has children with them because they, can't, they don't have time to get a babysitter or something, are people welcome to bring their young children or their children with them?
We'd prefer not, only because you will be going through an interview process when you get there.
Mhm. But if you have them, just come.
Yeah, if need be, we understand. But just
Mhm.
remember that, we will be sending you through an interview process.
Okay. So if you're bringing children, if maybe you can bring someone a little older who can take care of them or just keep them entertained while they while you're going through the interview process. Are you having any snacks?
We will
For
have drink stations and stuff for our applicants. Just because you may be there for a little while, so we want to make sure you do have some drink stations
Oh,
and things.
okay. All right. Yeah, I love a bottle of water. Some snack.
Especially because you're going to be talking a lot to our managers.
Yes, yes, and relax. I have to say, when you come through the door, we know it's easy for us to say because we are working, but please take a few deep breaths before the interview. Write some talking points down. Right, tell us what you know about us, Kaleida Health. That's also important on the interview because one of the questions could be, "What do you know about Kaleida?" And so just take a couple of minutes while you're preparing for our job fair. Just take a couple of minutes to write down, what do you know about Kaleida? That's also uh, good, right? It'll get you a couple
Yes,
points, right?
absolutely, absolutely. If you know about our
Yeah.
history, that's a great seller.
And the beginning of each program, there's always a overview of who Kaleida is, the hospital. So, all right, Julie. Well, I think we are out of time. Any one last thing you want to say?
Um,
Closing
just just come out and see us on October 4th from 12 p.m. to 7 p.m.
at where?
at Highmark Stadium.
Yes. And if you can register ahead of time, remember, we do have bus passes. We have a relationship with NFTA, so you will not have to even pay to take the public transportation. So again, I want to thank our guests for today. And our guest is Julie McNeil, Manager, Talent Acquisition, Kaleida Health Human Resources Department. Thank you, Julie.
Thank you for having me.
Yeah, you're welcome. Again, Kaleida is hiring all positions 18 years old, 18 years of age and up with at least a high school or a GED degree. Our careers begin. And that is kaleidahealth.org/careers. Come grow with us. And I want to thank you for listening to the show, to the Great Lakes Health Radio program, and also thank you for stopping me in the community and sharing with me the things that you would like to hear. Because remember, this program is about you and your health. And also, if you are interested in hearing any of our past broadcasts, please visit www.kaleidahealth.org/video. Again, that's www.kaleidahealth.org/videos. And feel free to share these, use the videos, review the videos, share them with your youth group, your church organization, your PTA, your PTO for your personal use. All of our videos, you'll see the titles, you'll hear the titles, and all of the information is factual. And I just want to say, next week, you will hear from my esteemed colleague from Erie County Medical Center, ECMC, and that's Cindy Bass. In 2 weeks, God be willing, you will hear from me, Francesca Messiah, Manager, Workforce Development, Kaleida Health. Thank you and have a wonderful week. Bye-bye.